this week on the BackTable podcast.
Yeah, I think even especially with PeriPeach, talking about severe tearing during childbirth, like from some people I heard, oh, well, my wife had 2 C-sections, so doesn't care at all. Or early on in my pitch deck, I have a picture of a 4th degree laceration. It's not a true one, but it's like a diagram of a 4th degree laceration. And I've been told that's too graphic. There are certain words you can't say vagina, you can't say vulva in front of these people. But to me, I kept it in my pitch deck because I was like, if this investor is too grossed out by this image, then we shouldn't be partners. This should be someone who sees it and feels the pain and is more invested after seeing that picture.
So welcome back to another episode of BackTable OBGYN, and it is my pleasure to have Tess Kim with me today. Tess Kim is someone I met through the ACOG Clinical Practice Guideline Committee. She is a minimally invasive gynecologic surgeon or complex benign gynecologist at Massachusetts General Hospital. She attended medical school at Emory and then did her residency at Beth Israel Deaconess Hospital in Boston and did her fellowship at MGH. And is here with us today to talk about innovation. She is the founder of the Fruits of Labor, a women's health medical device innovation company, and she has built her career at the intersection of clinical expertise, patient advocacy, and innovation in order to elevate the standard of care in OBGYN. So Tess, welcome to the show. Thanks so much for coming on.
Yeah, thank you so much, Dr. Park. I'm so excited to be here.
Call me Amy. We're a physician-facing podcast.
Yeah.
So tell us a little bit about the journey, because I think that is what is really inspiring for people. How did you come to be in this place? And I think that is really helpful for people, and it makes things more accessible.
Yeah, I think I never expected to ever have a medical device company or ever be in this place. I think when we're in medicine, we tend to stay in our own lane. We learn to, I'm going to stick with gynecology. I'm not going to try to do cardiology or radiology for a patient. And so thinking about this problem of people severe tearing during childbirth, I just thought it's so terrible. I couldn't believe that I didn't even know people tore until I was in medical school on labor and deliveries. And just seeing how terrible that problem was and doing what we always do, looking at the literature, seeing the ACOG practice bulletin guideline, level A evidence, warm compress prevents this by 50%. I was just really surprised since we never, in my medical school, we rarely did it. In residency, we just didn't have time. And thinking about, how quickly a towel cools down and those instant heat packs were causing burns. So just continuing to look at the problem and realizing we just needed a warm compress that lasted long at a safe temperature. It seemed like, wow, we should be doing this. And for a while, I thought, oh, there's a reason why that this doesn't exist. Someone's probably tried it before, but kind of realizing that a lot of women's health, unfortunately, quality of life hasn't always been a big priority for women in women's health. And so, yeah, when I realized it was just a warm compress that needed to be made, I looked into how to actually build that, realizing that, oh, I can start building prototypes in my own kitchen, and then realizing, oh, I think I need to start a medical device company, and kind of taking steps forward from there, and it became my company.
So the Fruits of Labor is a company that essentially is a warm compress for the perineum during labor. Is that what it is?
Yeah, so Fruits of Labor is the company, and then our first device was PeriPeach, which was like PeriPeach, Peri for the perineum, peach, since it's, everyone uses the peach emoji for their butt, and so it's to protect against 3rd and 4th degree lacerations. So that's where the name PeriPeach came from.
Okay, great.
But yeah, earlier this year, we got acquired by Medicines 360, which is the company that makes Liletta IUDs. They're a nonprofit. Yeah, they're amazing. And I think, kind of going down that startup route, feeling like the next step is to get VC funding. And so I was talking to a lot of VCs, venture capital, and I understand why VCs, they're like, hey, how are you going to make me 100x back? Very focused on the money. And it just didn't feel like the best fit for a lot of the people I was talking to. And so I reached out to Medicines 360, seeing that they've been so successful with the Liletta IUD. And it ended up being a great time for them because they were just building this innovation hub. They invested in the company and it been a really, really great partnership.
So tell me a little bit more about the journey. So you said that you saw tears first time in residency, like the second, third, fourth degree lacerations and delivery. And then I know when talking to you, you were talking about like the instruments that we're using. I mean, we're using things like the speculum and the tenaculum, and these are pretty old technologies. I mean, we're talking about like using the Sims speculum, and that's been around for a long time. So how did you end up in this space? Also, I mean, you're MIGS, and how did you end up getting this literally to fruition? Because I mean, I think MIGS, to be honest, or CBG, whatever you want to call it now. I didn't think there was a name that was worse than FPRS, but now you guys topped us. I mean, innovation is so much a part of MIGS, I think. And how did you end up developing this, I mean, essentially like an OB innovation while you're pursuing MIGS? And did you think that MIGS informed your process as you were pursuing it? So just tell me what your thought process was.
Yeah. I think there's just so much opportunity. As you were saying, our instruments are literally from the 1800s. There's just so much opportunity in gynecology. And when I was exploring kind of all these different ideas that I've had, PeriPeach was just kind of literally the most like low-hanging fruit. It's a class 1, simple, literally just a warm compress device. So I wanted to start with that device because it would be easier to get through regulatory and things like that. I would learn through that process and then start to go into more other devices. So the next device I'm working on is called Mellomallows. It's these lidocaine puffs that attaches to the ends of a tenaculum. So you don't have to worry about the syringe and everything. You just snap it onto the ends of a tenaculum, place it on the cervix. It dissolves kind of like a Listerine breath strip, and then right before you place the tenaculum. So it doesn't add any steps for physicians or anything.
Oh, I love that. Those breath strips, and then the little rice candy. The little like clear wrapper that dissolves. That's pretty cool. That's a great idea, because actually when I was on ACOG Clinical Consensus, that whole TikTok and IUD placements as extremely painful came out, and we came out with a committee opinion on, or what, I can't remember what they're called again, Clinical Consensus Committee opinion on on analgesia techniques at the time of cervical instrumentation and dilation, etc. So I love that idea. That's a great name.
And unfortunately, I feel like patients speaking up, it's been really great that patients have been vocal, sharing their story. I think unfortunately some of the message goes to, oh, my gynecologist doesn't care, or they don't care about pain. And I think it just goes, you and I know it goes so much deeper than that. There's this really deep culture of, unfortunately, like pain not being taken seriously when these instruments were even made and we're trained to be using them, like tenaculums on people without any lidocaine. And I think also just realizing how busy a clinic is, and if you're going to add time to anything that we do, it's just, unfortunately, it's very hard to get a new innovation introduced that introduces any time. And I think physicians do care, and they do want to, obviously they want their patients to have a better experience, but there's just so many other barriers in the way.
So tell me a little bit more about this compress. So basically it stays warm for a long time at a safe temperature. Is it like one of those heat packs like you're saying, or is it like a towel, or what is it?
Yeah, so I started to look at just all the different ways that heat's provided, like electric heat warmers, or things that you can snap and things like that. And actually, I was in the NICU for a few days because I was like, oh, let me just see what the NICU during my elective block. And I met a fellow who introduced me to a neonatologist who was creating a neonatal warmer in Rwanda, where they don't have electricity. They needed something with a really high safety profile and was really reliable for a long time. And it was made of this special type of wax. So when you think about even the wax that you put on your skin, it stays warm for a really long time. And so when I met with her and thinking about this warmer for neonates in Rwanda, I was like, oh, this is actually perfect for us on the perineum. Easy to use, very high safety profile, and supplies readily available. And so just kind of adapting that idea to women's health. I think there's just so much of that, especially within GI and interventional, like radiology, anything like that with a catheter where you dilate. I think about the way we dilate the cervix is so archaic. And there's so many other ways in GI, cardiology, IR that we can dilate in a hopefully less painful, more accurate manner that I hope that we can start to kind of cross and bring these innovations more to gynecology.
Oh, that's a great idea. Like, I know I remember seeing the little stents and then you just, use a balloon and blow it up. So that is a really good point.
And thinking about the bladder, so this professor at MIT she worked on a lot of cardiac devices, and she was saying the heart is a muscle that fills with fluid and pushes it out, just like the bladder. And so she was actually looking at how can we use these cardiac devices on bladder issues and similar things with the bladder.
That's awesome. No, I love that. And then I think that this is super interesting what you're talking about, Medicines 360. I mean, it's a nonprofit. You explored the venture capital route. And I think one of the things that you told me about is that equity is a key component of PeriPeach. And
Yeah.
yes, of course, you want to make money and you want to bring to market, but you want to keep it accessible and so people can actually use it. So I think that's really awesome. But tell us a little bit more about your development process and how did you get to the point where you developed PeriPeach, you got acquired by Medicines 360s? Like, were you forging your own path? Did you have like a incubator? I know there's a path at Stanford, like Eric Sokol. He teaches in a course and he went through this course. Like,
Yeah,
how did you find your way here?
For us, we're so lucky in this day and age that YouTube and ChatGPT, you can really learn so much through YouTube and ChatGPT. So first I started to do like Y Combinator startup school online, and I even like borrowed a textbook from the library. And yeah, Harvard has Harvard Innovation Lab, which is this amazing incubator for any Harvard student that had such amazing resources. And just taking it kind of step by step, I think medical devices takes a very different track than other startups. But yeah, so once I got the idea for the wax, I was thinking, like, how can I encase this in something where the temperature can pass freely and it can get really hot and cold? And I was like, oh, sous vide bags. Sous vide bags do that. So like, okay, let me order a sous vide machine from Amazon, this wax I can order online as well, and then just started to make them in my kitchen. And I think like each step of the way, it's like, well, I feel like in medicine, we put up our own barriers. And so I was like, well, I'm not an engineer. I can't build that. It's like, well, what would I ask an engineer to do? Or like, I can't start a company because I don't have an MBA. But realizing, oh, if my grandmother could run a company, her own cleaners for 20 years in New York, like I could start a company with like all the resources that I have today.
What kind of cleaner? She had a dry cleaner?
Yeah, it was called OK Cleaners. It was in Queens, New York. And it was amazing because where she was the most, oh my God, what's it called? Elmhurst, New York. It's the most diverse area in the whole country, most languages spoken. And so the people who come into her cleaners, they wouldn't know how to speak English, but she would just say like, okay, this is $5, this is $10. That was the whole interaction done. She did that for 20 years.
I have to say, even dry cleaning, it's like a whole chemical process and people taught themselves. I mean, they learned how to do it, and they didn't speak English. So it is pretty amazing. But anyway, sounds like you did a lot of pre-work on your own and you were really motivated. And was this when you were a medical student or residency?
This was during residency, which was, when I look back, I don't know how, because residency was so hard. But I think residency being so hard, it was kind of an outlet where in medicine, I mean, you don't want your doctor to be really creative. You want them to kind of go by the book. And so this was kind of my way to have like a creative outlet. And so it really became more of like a passion project for me.
What other resources did you use? Did you use any resources in Boston? Did you use AI? Like, how did you get, tapped into, I mean, because I'm assuming you had some help along the way from some sort of innovation, like incubator lab or something.
Yeah. Harvard Innovation Lab was so great. They have like all the mentors and like all the webinars and resources that I could have ever dreamed of. And so, yeah, just kind of applying for all their funding opportunities. Small, like the first grant I got was $250. And then the next grant was $1,000. The next grant was $10,000. And then just kind of building on there. And yeah, they were so supportive and so amazing. It's great to see that every institution has started to have some type of innovation hub. And I know Mass General has a few to even help physicians and attendings develop their idea, because it definitely has been a whole new way of thinking and a whole new curriculum in education for me that's been exciting.
And then, I know that when we were talking at the meeting, you were saying that you had mentioned something about vesicovaginal fissure in MIT students. So can you tell me a little bit more about that? Because you said that they are engineers. So
Yeah.
you're explaining all this biomedical or this biologic processes and how labor works and all these other things to them. And they're approaching it from a completely different mindset and lens of like the engineering. But tell me a little bit more about that.
Yeah, so one of the devices that this professor was thinking of, it was a cardiac device, but to put into the bladder to help block leakage from the bladder into the vagina when, unfortunately, in a lot of like underdeveloped areas where women can go through pregnancy at really young ages, end up with these terrible vesicovaginal fistulas. And as we're working together, I remember they asked me, oh, when we place this device, should we place it through the vagina or through the bladder? And for gynecologists, we're like, oh, okay, yes, definitely through the vagina. It would be very hard to insert something through the bladder. And then also as we're talking, I said like, oh, we have to make sure that it doesn't block the ureters. And then they asked like, oh, well, what are the ureters? And it just made me realize just how much of a like disconnect. And of course, like, why would they have to know what the ureters are and that it would be easier to place vaginally? And when they were talking about like tensile strength or, I mean, I don't even know. It was just a whole nother field, a whole nother thought process that I hadn't even heard of. And so I think having this collaboration early on is really important, especially with women's health, because I mean, we get to do this every day, but I feel like, especially when I talk about birth, birth is such a private thing and private event in the US. I think a lot of women's health is so private. And so with this company, and part of it is advocacy for patients to improve our instruments, because I feel like it's a way to advocate for patients by improving our instruments to make the gynecologic care more painless and more comfortable for them.
Absolutely. And then how do you think, well, I assume that you had collaborators. How did you build your team?
Really through Harvard Innovation Lab and finding my mentors there. I feel lucky because a lot of them are people who have like been extremely successful in their careers and now they're just coming back to mentor out of the goodness of their heart. And I think especially at Medicines 360, one of the person I work with closely from Medicines 360, part of the contract was that it has to get to this many underserved women and that the price actually can't be astronomically high where it would be inhibitory for patient and access. And so I think finding those right people, it can be hard in the business world. I've definitely been burned many times, but I think that there are those really good people to collaborate who really do want to push women's health forward.
Did you have to do those pitch meetings? Because I've seen your Instagram profile and, like you're doing TED Talks and like trying to get hustle for some funds and get like prototypes. Like, how did you even get a factory to do, to produce your stuff? And how did you get the funds to do that?
Yeah, the pitching has been a whole new skill to learn. But yeah, no, pitching has been really fun because I also see that again as like a way to advocate and talk about, well, with PeriPeach, it was to educate people about severe tearing during childbirth. And yeah, now I get to talk about the tenaculum and gynecologic care and pain with women's health. And so I think one of the pieces of feedback I get from my pitches is people can hear how passionate I am and how like personal I feel for these problems. So it's been really fun. And I think it's actually been nice to be the kind of imposter in these situations. Like a lot of people are from business backgrounds or tech backgrounds. And I think being a physician, being like firsthand, seeing what's happening to patients definitely can resonate and translate through the pitch.
How did you learn how to do the pitch? Did you just get coached on this and you watched a lot of them?
Oh, yeah. So I definitely had a lot of coaching. After college, I taught high school for a couple of years, and we used to have to record ourselves and watch ourselves teach. And I remember feeling so cringy about it, and then also feeling really embarrassed because even if I like gave I thought a really great lesson, I would see like, oh, there are like 3 kids texting in the back of my room, not paying attention at all. But I'd say those videos and kind of watching myself were some of the moments that I learned the most, and being vulnerable helped me learn the most. And so with pitching, it's been a lot of recording and just saying things over and over and over again. And yeah, but it's been a lot of fun.
How much funding were you able to get total for this project?
For PeriPeach, grant-wise, and a little bit of VC funding, a little over $100K, and then the rest with, I don't know what numbers I'm allowed to share, but and then with Medicines 360, kind of with that deal, that's been a really great partnership where I'm not sure how much details I'm about to share about that, but they've been great.
I'm assuming since they produce Liletta, I don't know too much about the company, that they have the ability to scale up, number one, and number two, to market. Like, how are we going to get
Yeah.
this product into the hands of our physicians and on our labor suites? Because it seems like you need a physician champion. I mean, there's a reason why companies have workforces that they scale up and they come to your office and they're selling all the things. So how does that work?
Yeah, I think for me, my passion lies very much in that early stage idea generation. So when it comes to sales and marketing, I'm very appreciative that Medicines 360 will take the lead on that. And yeah, that's one of the great things about partnering with them is that they already are very well versed in the women's health space across the country. And they actually started because they were trying to get more IUDs to women in like federally qualified health clinics. Bayer was not giving discounts on it. And so they decided to create their own IUD. And then that's when Medicines 360 came an affordable IUD. This was before the Affordable Care Act as well. So they were trying to make an affordable, like something that people could pay out of pocket for an IUD. But yeah, now, I mean, you can see like the studies are equivocal and they're doing really well, showing that equity actually does mean more money and access.
That's pretty amazing. And then how have you, like these lidocaine, what is it called? The marshmallow?
Mellomallows, yeah.
Mellomallows. Like how are you able to create this little lidocaine? I mean, like, do you partner with like chemists or how do you get this done? I mean, it's a great idea. I love it.
So so I've been asking ChatGPT, how do you make Listerine breath strips? How do you make marshmallows? How do you make all this stuff to kind of learn and experiment in my kitchen? But yeah, I am at that point right now. We're looking for pharmaceutical partners to kind of bring this a little bit more forward now.
Oh, that's pretty amazing. I love that so much. What would be your advice to people who have an idea that they want to bring forward? Because I know I've seen a couple of these talks and it's like partner with your resources, like Stanford, has a program and it sounds like Harvard had a program and, they can help you with the patent process and filing the patent and you own it for a year. And then, partnering with industry, getting the legal stuff all in place. And then, some people bring it to industry, like in Urogyn space, people would bring it to Boston Sci or whatever it is. You had a company of your own and you got acquired. Like there seems to be different pathways. How did you choose yours? And how would you advise people to navigate that in the future?
Yeah, I think my pathway from what I've heard is very unique. A lot of my mentors at Harvard Innovation Lab had never heard of kind of partnering with a nonprofit before. But I think just continue to be focused on the problem that you're trying to solve and what is the best solution for that. And so that's why I think physicians are actually at a really great place to kind of be at this early stage because we understand the problem really well from multiple patient perspectives and to help like really build that foundation for whatever startup or device that you think that you'd want to make. Yeah, being really focused on the problem. And as physicians, like we can see the problem, and I think especially with ACOG as well, we can see, okay, for this problem, is it a policy change that would be the best solution? Is it a new medical device? Is it AI? And I think oftentimes people do it the other way where they're like, AI is this really cool solution. What problem can we use it for? And I think that's a little bit more reverse and people don't understand how, unfortunately, in women's health, our research, especially for endometriosis, isn't super robust. And when you use AI, you need really robust data. And so I think kind of using this, AI for this, AI for that I'd be wary, I guess. AI is amazing, but I think it's not the solution for everything.
So AI is a tool, as you're saying. It's not the end. It's like a means to an end. It's like utilize it sparingly. But I know you have some concerns because we've talked about this. Like, like we were talking about this at our meeting. I mean, there's privacy concerns, like our thought processes and our insights are what they own because they're looking at everything, right? Like, tell me a little bit more about what your thoughts are on that.
I think I'm very concerned, especially with women when it comes to women's health, because we obviously get to hear patients' kind of most intimate personal histories. And it's still not 100% clear to me what the regulations and what all these recordings will go into. And I don't know if I have all the trust in the world for these AI companies, because I think we're already on our third AI kind of system. And so thinking about kind of tech and the turnover and what happens during these turnovers, especially when it comes to selling data. I'm definitely very concerned, and I'm not sure if the people at the top of these hospital systems who are making the decisions of what AI systems to use fully understand how private some of this fertility and reproductive health can be. But yeah, I guess I'm concerned.
I find this funny because you use ChatGPT in your
Yeah.
processes, but like when it comes down to like the nitty-gritty of, I mean, our AI scribe was acting up today and I was like literally in a panic. It was a circle of death was served up to me, and I'm like so dependent on it now because it's so amazing and efficient, but it is like everything is recorded,
Yeah.
and it is, I'm curious, like we're about to embark on this AI like sort of black box OR recording in our ORs.
Interesting.
And not soon, but it's in the works. I know that. It seems like who can access that? The legal system, our patients, recording all the thoughts that our stream of consciousness thoughts in the OR. I mean, sometimes there's F-bombs, sometimes there's commentary, it's not for everyone's ears. You know what I mean? So I share your concerns, I guess, is how I would put it, because there's a lot of ambient eavesdropping.
Yeah.
Right?
Yeah. And it's hard to know where all these recordings go. Like, how do they get de-identified? Are these companies like in different countries, so they have different laws that they have to go through? But I agree with you though that the solution isn't that gynecologists should not use AI. I don't think that's fair because it is such a helpful tool. But I think we just need to be extra cautious.
Well, I do think, and I wanted to just get your take on this, but I know in Urogyn, we were so innovative and known for innovative, because we're MIGS was 20 years ago. And then the whole transvaginal mesh and robotic controversy and Morse-Slater controversy and Escher controversy, it was like the early part of my career, because I came out of fellowship in 2009, and the 2010s was just like all of it. And I think it casts a pall on innovation.
Oh, for sure.
I mean, in GYN specifically, because in OB, there's always been the long shadow of OB-related liability, but GYN felt like a little bit more of a safer space. But then I look at these other fields, like you alluded to GI and IR, and it's super techy. And then same with, I look at urology, I look at general surgery.
Ortho,
I mean, ortho, they're neuro, they're very innovative. CT surgery, like a lot of people are innovating, and neurosurgery has pretty high liability too, but I don't know. There's something like, what is your thought on the culture? Like, it does cast a pall, I think, though.
Yeah. No, I mean, people tell me all the time there's no money in women's health, and the data shows otherwise. McKinsey did this whole thing where it's like, no, women make 88% of the medical decisions in families. Like, there is money in women's health. It definitely hasn't had that attention because of all those controversies. But I remember there was actually this MBA student who was talking to me, and she told me she went to AAGL and she went to the exhibit hall. And I was like, oh, wasn't it so cool? All these things, like all these new innovations. And she was like, actually, like, I come from the cardiac and IR space, and like those exhibit halls like would blow your mind compared to what AAGL. And when I do think about like a lot of the innovations in when you go around the exhibit halls at any conference, it's like different exam chairs or like rainbow colored instruments, or like there's not as much new and exciting, I guess. And yeah, but I hope that we can start bringing some of the other ones like GI and cardiac and stuff over to GYN.
Yeah, I'm hoping that the pendulum can swing somewhat, but I think it made people pretty conservative. I think that it is starting to shift a little bit, but and I think that also the other thing I do see is I like the fact that academic centers are trying to foster this innovation culturally.
Yeah.
But I would say that academic centers also are pretty conservative. I mean, Boston is very conservative. It's been known as a very surgically conservative.
Yeah, we have like no robots. Like,
I mean, that's been the reputation there for a long time, with very, like, this is a pretty big generalization. I mean, there's a couple of bright spots here and there, of people who, like, I think Jan Einertsen is pretty innovative, and he's known for that.
But now but that's unfortunately that what you were saying, like it can be really hard to innovate in academic medicine. And unfortunately, we've all seen a lot of people leave academic medicine.
Yeah, I do wonder about the culture. I mean, Cleveland Clinic, I would say that's been historically our culture. Like we have the tripartite mission, clinical, education, research, and then innovation has been the fourth leg of our
Oh,
stool.
yeah, they've been talking about adding it at Harvard.
Yeah, so we have a long tradition of it, and that's been something that has definitely been embedded in the DNA, and we have a pretty robust like incubator program and innovations. And we even have like a vice chair of innovations in each institute.
Nice.
And
Oh, wow.
like I went to one of these like pitch deck kind of, it was like a Shark Tank kind of funds. I think they gave like $50,000 or something like that.
That's
But I
good.
mean, I think that there's definitely space for, I mean, there's a lot of people who want to develop these skills, but I think that these are all things that programs and centers can do to
Yeah,
for sort
agreed.
of foster, because the thing is you Googled these resources, you
Yeah.
bootstrapped this scenario, but you also had a
Yeah.
lot of resources in Boston, right? And
Yeah.
that the BI is part of the system, and then you are now staff at MGH, and presumably, I mean, I'm assuming that, since you developed it as a resident and fellow, there's some part of the patent process that they have a part of too, right?
I will talk to you about that offline. Oh my God. It was just, yeah, that was a
Yeah,
process. But
yeah.
yeah, I'd say, yeah, I will tell you more about that another time. That's unfortunately why I've seen people leave academic medicine. But I think it's great to have kind of what you were saying, these programs kind of help physicians get more in the innovation space and be with engineers in those early stages to talk about those kind of what we think is simple anatomy, but don't realize it's just like such a personal thing for patients.
Well, the other thing that I do think is super important to point out here is that you're a woman, and a lot of the people who have industry ties or
Yeah.
VCs or are
Yeah.
in this space are men. And it's really important for women to engage with industry and to innovate and to be present. Just
Yeah.
being you is powerful, I think. And how did you hold space in this space?
Yeah, I think even especially with PeriPeach, like I talking about severe tearing during childbirth, like from some people I heard, oh well, my wife had 2 C-sections, so like doesn't care at all. Or like early on in my pitch deck, I have a picture of a 4th-degree laceration. It's not a true one, but it's like a diagram of a 4th-degree laceration. And I've been told that's too graphic. Like you can't say like there are certain words you learn. You can't say vagina, you can't say vulva in front of these people. But to me, I kept it in my pitch deck because I was like, if this investor is too grossed out by this image, then we shouldn't be partners. Like this should be someone who sees it and feels the pain and is more invested after seeing that picture.
Were there like women's health specific incubators or places that you could turn to that were more receptive, or you just had to find allies where you could find them?
Right. I think now's the time for women's health. Like there's been so much more money put into women's health. I think these kind of studies showing that right now, like women's health is, you have a high rate of return for women's health if you invest in women's health. I think right now is the time, and there have been more women's health kind of startups popping up. I was actually just part of one in Rhode Island with a design firm where we were a group of 5 female founders and kind of worked together with our different startups. And yeah, we just finished our program last week. But yeah, I think there's been a lot more that have popped up and it's been great.
How did you form your company? Like, did you Google how to form your company and then like get a lawyer friend to draw it up, or like how did you do that?
I mean, ChatGPT'd and then just asking mentors too, because there's like all these different types of companies that you can make. Honestly, I was like, oh, I want to go I want to be a nonprofit, but then learning like there's caveats to that. And yeah, and then there's like startups to create startups now too. They help you with all your like paperwork and documentation.
How many people are in your team?
Right now it's me and my dad and we have our lawyers and trying to find some more partners from pharmaceutical, but yeah, it's just me and my dad right now.
What is your dad's background?
My dad, he has a PhD. He did some research at Dana-Farber and Harvard as well. And so I remember so I did my residency at Beth Israel. And I remember when I was a kid, when I was in his lab, and I could see the sicko sign from his lab when he used to do research way, way, way back in the day.
Is he in industry now, or what does he do?
No, he's retired now. So he just
okay.
loves like tinkering and helping me with some of my new projects.
I think it's so interesting. Like, we watched the Taylor Swift documentary and
Oh, I need to watch it.
oh, it's very good. It's Miss Americana. I think it's on Netflix. But anyway, my son is a huge Swiftie. And
I
her
love that.
yeah, he's
I
huge
love that.
Swiftie. Her father is like a personal wealth advisor or, at Merrill Lynch or something like that. And then her mother is a former marketing executive. So I was like, they really were able to advise her, pretty
Nice.
well. So I feel like having those resources or having friends, like being in Boston and coming from this general milieu,
It's
you
been
probably
great.
like you probably know people in Boston who are interested in this,
Yeah, and I've definitely built my network, and it's been fun to build a whole new network of people as well. And I think, especially the network within women's health, they always want to speak to a physician. So it's been great.
Oh, that's awesome. Well, I don't want to keep you too much longer, but I want to just say tell me your parting words of advice, because I've heard certain themes. I've heard parlay your passion, use your resources online. You were very resourceful in finding local resources in addition to the online resources. Network. Like, would you add anything else to your key points? Because I think you're just also like a super go-getter, and you're actually very extroverted too. I think this would be hard for introverts,
Yeah. No, I do love meeting new people, and especially in the industry, just meeting new people and learning about kind of how they got there. But yeah, I feel like for women, especially, just listen to your gut. And if there's this problem that's been really bothering you, just keep pursuing it. And I feel like if more women were just able to listen to their gut and follow that, we'd save a lot of time and energy.
That's amazing. I just look at the example of like when my kids were babies, and I just remember looking at this stuff and just being like, is this the best we have? Like, this breast pump
Yeah.
sucks, like the Medela
Yeah.
or whatever. And then now they have the Bluetooth ones that you can't even hear, and they're wearing it through clinic. Like,
Yeah.
all that stuff is like, why weren't you here before?
I think now we're finally taking women's quality of life more seriously. And honestly, a lot of it due to social media, people speaking up. But yeah, I think for us, we just need to like elevate this kind of standard of care that's been in women's health to a higher place.
Yeah. And I remember talking to my former fellow is Jocelyn Fitzgerald, and she is at that nexus
yeah.
of like pelvic pain and urogyn and MIGS and complex benign gynecology. But, she said she was talking, she and I were at a meeting, and we were just talking about like when she talks to researchers, and these cancer researchers listen to the endometriosis, and they're like, why can't we have the best like cancer minds on this case? And we could have like solved this
10%
problem.
of the population.
Yeah. And they were like incredulous, like, wow, why can't we apply the same kind of methodology and techniques to solve this puzzle? Not that it's solvable, but to address this really vexing issue. And it's true though.
So true. True.
I think I think Louise Perkins King, we've had her on the podcast a couple times, and she's one of your mentors, I know. We love Louise. And she has said that the incentives do not align, and the innovation does go with incentives. So, and also just in terms of the reimbursements and everything else. So
yeah, but that's why I love like so then the reimbursements are issue. Dr. King and Dr. Fitzgerald, they're fighting for that for us right now. And I think just not giving up and fighting, just keep on fighting this battle. I think that's what we have to do. But I'm so thankful for them for helping us fight that battle.
Yeah, and making the arguments over and over again, because you can't, you have to love it in order to live this message and evangelize, because I'm sure sometimes you just don't want to look at your pitch deck anymore, and you don't want to go in front of people anymore, and you're passionate about it. You really believe in helping women and preventing tears and, all this stuff. So I really appreciate hearing about it. I love the
Thank
journey.
you so much. I was actually more scared for this than any pitch I've done so far.
Well, these are actually the pitch is funny because you're right. It's like VCs and other people that aren't your people, but this is squarely your audience.
Yeah.
BackTable OBGYN crowd. So the listeners will learn from your insights. So thank you so much for coming on the show. And I think you're on Instagram.
Yes.
You can DM Tess. What's your handle?
Tess Kim MD.
Tess Kim ND, also at MGH and at PeriPeach. So there's a lot of ways you can reach out to Tess. And I think also the other thing that I've heard throughout what you're saying is just so much community. Like there's a lot of people mentoring other people in this space. And, you're finding a different community than in medicine, which I love.
Mm-hmm. Yeah,
That's pretty cool.
It's been really great. Yeah, like I'm going to go to Japan in April and one of my mentors just moved there and I'm going to stay with him for a couple nights too. So it's been nice.
That's awesome. All right, cool. Well, thanks for coming on. And I also am so grateful, ACOG, to bringing us together because I get to meet such smart people like yourself who are trying to change the world and move medicine forward and to help women. So that is what actually inspires and keeps me young is like just thinking about like all these things that like these are little, but this is an innovation and this is like a need, so it's like addressing the need. It's a huge, I don't know, it can really make a huge impact. So thank you for doing the work that you're doing and for keeping on in this space. And I can't wait to hear more about your future inventions.
Thank you so much. I really appreciate it. Thank you.
All right. Take care. Bye.
Bye.
Thank you so much for listening. If you haven't already, make sure to follow the podcast, rate it 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable OBGYN on Instagram, Twitter, or LinkedIn. BackTable OBGYN is hosted by myself, Mark Hoffman,
and Amy Park.
Our production team is led by Kieran Gannon,
Aaron Bowles,
Gabe DeGrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz, with support from
Taylor Spurgeon Hess and Yvonne Orgodzinsky.
Show notes and social media by Emma Landenwich and Lindsay Beecham. Administrative support provided by Judy Dela Cruz.
Music written and performed by Scott Baby Daddy Hoffman.
Thanks for listening, and we'll see you again next time. The views and opinions expressed by the hosts and guests on BackTable OBGYN are their own, and do not reflect the views or positions of their employers or any entities they represent.